Our video today is short essay training questions locomotor module. I will give you sample of questions and how to deal with each question. First question will be, what are steps or mention excitation, contraction, coupling? Mention, I want names only. I don't want any discussion. So steps will be action potential, reach the nerve. Second, opening voltage gated calcium channel on the nerve surface and the calcium influx. Third, calcium bind to vesicles, force rupture of vesicles to release acetylcholine. 5. Acetylcholine bind to nicotinic receptors in the motor end plate. 6. Opening of voltage gated sodium or potassium channels inside nicotinic receptors, causing sodium or potassium conductance. Then changing local potential, which is motor end plate potential, into action potential to be propagated across the surface of sarcolemma to spread by T tubules or along by transverse tubules. T tubules has got dihydropyridine receptor on its wall, which is a voltage sensor. It will open, action potential will reach the cisterna of the sarcoplasmic reticulum. So calcium will bind to ryanodine receptor on the cisterna, and this ryanodine receptor is ligand gated channel. Then calcium release from sarcoplasmic reticulum. Calcium will bind to troponin C to remove the tropomyosin, which cover the active sites of actin. So actin now will bind to myosin and cross bridge cycling occurs. So in our exam, we want to mention steps of excitation, contraction, coupling. Either I ask you steps before action potential arrive to sarcolemma, or steps after arrival of action potential from the sarcolemma to sarcoplasmic reticulum till contraction occur. Second question will be, what is the mechanism of skeletal muscle relaxation? Muscle relaxation is an active process. Calcium reuptake by calcium ATPase pump. Once calcium is reuptaken, so calcium no longer bind to troponin C, and the tropomyosin return back to its position to cover the active binding sites of actin till cessation or stoppage of contraction. Third question, what is sliding filament theory? I mean by sliding, actin molecules move along the myosin head and there is no shortening of actin or myosin. I band or A band doesn't shorten, they overlap on each other. Fourth question will be, mention the steps of cross-bridge cycling. 1 is binding, 2 bending, 3 detachment, 4 recycling or re-energizing. I want you to know that bending has also another name called the power stroke. So our fifth question will be, what is power stroke? Power stroke means myosin head bend and pull the actin molecule toward the center of sarcomere. ATP on myosin head is broken to release adenosine diphosphate plus inorganic phosphate. I want you to imagine that when the myosin head on the right side pull the actin molecule towards the center of sarcomere, the Z line, which is mechanically bound to actin molecule, displaced inward, and the same thing occur to the Z line on the left side. So the distance between two Z lines shorten, which I mean sarcomere length. Sixth question. What is walk-along theory? Walk-along start from calcium release from sarcoplasmic reticulum, calcium bind to troponin C, then it will remove the tropomyosin to uncover the actin active binding sites, then cross-bridge cycling occurs. So I want to pick up a very important information. Cross-bridge cycle is a part of walk-along theory. Question number 7. What is the role of calcium? Calcium is the link between electric event action potential through calcium influx to the nerve to bind to vesicles, then vesicles will rupture to release acetylcholine, and mechanical response regarding contraction. Question number 8. What is the role of ATP? ATP is important for contraction and relaxation. So there are 3 functions of ATP. 2 regarding contraction, 1 bending, and 2 detachment. All of us know that myosin head should detach or separate from actin molecule to bind to a new ATP, and detachment doesn't occur after death, and there will be a question regarding that. Regarding relaxation, ATP is important for calcium ATPase pump to reuptake calcium again into sarcoplasmic reticulum. Question number 9. What is rigor mortis? I want you to know that the word rigor means muscle stiffness and mortis means death. Muscle stiffness after death. Why? Because myosin head continue to bind to actin molecule. There is no detachment due to ATP depletion. Now you are dead. There is no mitochondria to resensitize ATP again. And muscle stiffness is observed after 24 to 36 hours after death. Question number 10. What is muscle contracture? Contracture means prolonged muscle contraction without relaxation. Prolonged contraction due to excess calcium release from sarcoplasmic reticulum, while relaxation is delayed due to delaying calcium ATPase pump. Question number 11. Define fatigue and mention its causes. Fatigue is decreased force of contraction due to previous contractile activity. But I want you to notice something important, that the muscle regains or its activity or recovers if it is re-stimulated again. Mention, I mean only titles. Mention equal list equal enumerate. Number 1, neuromuscular fatigue, because there will be depletion of acetylcholine vesicles. Breakdown of vesicles is more than its formation, ending by fatigue. Second, accumulation of lactic acid, which cause muscle cramp, especially for marathon runners who run for 10 kilometers before Olympic Games. Third will be psychological fatigue. You lose the will to move. Question number 12. What are the factors which onset of fatigue, I mean by onset, start of fatigue, depend on? Factors are duration, intensity of contraction, which seems to be logic. If the contraction is more tense for a short time, like weight lifting or 100-meter race, these exercises require heavy effort for a short duration, so fatigue will be rapid. And we will have a question regarding this. Second factor, type of muscle fibers. And this will lead us to question number 13. Compare between red fibers and white fibers. Before comparison, I want you to know that red muscle fibers have also other names: slow oxidative fibers and type 1 fibers, while white fibers have other terms: fast glycolytic fibers and type 2b. Comparison regarding what? Either the examiner will give you the comparison titles in the table which he wants, or I told you I want 4 points of comparison. For example, regarding muscle contraction, slow fibers slowly contract, slow cross-bridge cycling, slow myosin ATPase activity. I didn't need the ATP to be broken rapidly in order to be slowly fatigued. Endurance capacity or tolerance is high. Capillaries more, myoglobin more, mitochondria more. All which I said is the reverse in fast glycolytic fibers. In slow oxidative, source of energy is glucose, while in fast glycolytic, source of energy is glycogen. Fast glycolytic fibers have large diameter of upper limb, while slow oxidative have large diameter of lower limb. Site of fast glycolytic fiber is upper limb, because suppose you are lifting a heavy weight with your hands, you are going to be easily fatigued. Then if you stand for a long time, you will be slowly fatigued. So site of slow oxidative muscle fibers is lower limb. Question number 14. What is mechanical efficiency of a muscle? Mechanical efficiency equal work divided energy expenditure by a muscle times 100. I want you to know that mechanical efficiency equal 0% in isometric contraction. Isometric muscle length is constant. You try to lift a heavy weight, but you fail. And you know from physics, work equal force times distance. So if you fail to lift an object, the distance covered equals 0, and anything times 0 equals 0. So work done equals 0. While in isotonic contraction, mechanical efficiency equal 25%. 75% remaining as heat to separate myosin from actin, to decrease friction or viscosity between them. And it seems to be beneficial because myosin head needs the space to make bind, bend, detach, and recycling. So heat here is beneficial to help or to increase force of contraction. Question number 15. Compare between isometric and isotonic contraction. Isometric means what? The contractile element, if it is shortened, I mean the distance between two Z lines shortened, it will attract or pull the elastic element, which is a tendon. Tendon all the time is mechanically attached to the muscle. If muscle contract, tendon will be stretched. If this tendon in series, serial elastic element, is stretched to compensate the decrease in the muscle length, overall the net muscle length will be constant. I mean, it will compensate the decrease in the distance between the two Z line. This is isometric. Length is constant, tension increases. I mean here by tension, stretch of a tendon, which is passive. Tendon doesn't consume ATP to be stretched. It is mechanically secondary to muscle contraction. What about isotonic? Isotonic contraction, the elastic element cannot compensate for the shortening of the distance between the two Z line. So here, muscle length in isotonic contraction is decreased and tension will be constant. Tendon is stretched for a while, then it is fixating. It fixes in its new position. What about work done? In isometric, work done 0. In isotonic, 25. What about heat? Heat production is more in isometric because isometric contraction has got another example. During standing, gravity tries to pull you down, to let you fall. The response will be mild contraction. Mild contraction all the time will release heat. All the time you are facing gravity. You have contraction in anti-gravity muscles, which ends by more heat production regarding isotonic contraction. While isotonic contraction has more energy production. So example of isometric contraction are two. Facing gravity to maintain your posture. Your trunk is upright position. Second example, failing to to carry a heavy weight. Question number 16. Define motor unit and neuronal pool. Motor unit means single nerve fiber coming out from anterior horn cell of spinal cord to supply single muscle fiber. Everything is single in a motor unit. Neuronal pool, I mean multiple or collection of neurons supplying multiple muscle fibers. Question number 17. What is motor unit recruitment? Before explanation, recruit means increase. So it is additional increase of motor unit or activation of motor unit upon stimulation due to increase in voluntary movements, which means that not all motor units are contracting at one time. You need the motor units which are not contracting to be added as a power or extra power for the already contracting motor units. Question number 18. What is motor unit size and innervation? I mean by size, small or large. Small motor unit, example in finger muscle, contain 3 to 6 muscle fibers. And this is important for precise or fine movement. While large motor unit are present in trunk, for example, contain 120 to 160 fibers, and this is important for gross movement like wrestling, like swimming. You need large motor units to work. Regarding innervation, you have fast and slow motor units. If I tell you fast, then remember fast glycolytic fibers with all its criteria. And the small motor units, slow motor units, so remember slow oxidative muscle fibers regarding all its criteria. Question number 19. What is the relation between muscle length and tension? It will be the same as I will ask you, explain Starling law. It will be the same question regarding preload. I mean by this, strength of muscle contraction is directly proportionate to increase muscle length within limits as explained by Starling law. I mean that muscle length, it's a maximum or optimal length to cause maximum muscle contraction 2.2 micron. If you exceed more than that, force of contraction decreases, and I will explain to you now why this occurs in other questions. What do you mean by preload? I mean by before, and load I mean carrying a heavy object. Before you carry an object, the muscle is already contracted. And so question number 20. What is the difference between passive and active tension? Passive tension, stretch of series elastic element. You don't need ATP breakdown. It is mechanically secondary to muscle contraction. Active tension is the contractile element should be activated or cross bridge cycling. You need ATP in bending and detachment. Total tension equal active plus passive tension. So Question 21. Define resting muscle length. It is the length at which maximum active tension is achieved at 2.2 micron. So we have different term with the same meaning. Resting length equal initial length equal L max, maximum length, equal preload. Question number 22. Explain why at very short initial length force of contraction decreases. If we have a short initial length, this means that actin molecules are crowded at the center of sarcomere. If actin molecules are so close to the myosin head didn't have the enough space to bind, bend, detach, recycle, ending by decreasing force of contraction. Question 25. Define L max. It is the same. Maximum length of the muscle at which maximum active tension is achieved during rest. Question 24. Why above 2.2 micron, exceeding the limit, force of contraction decreases? Because actin molecules are going to be pulled away from center of sarcomere, and number of active cross bridges are going to be decreased, ending by decreased force of contraction. Question number 25. What is the relation between velocity or maximum velocity Vmax and after load? There is inverse relationship between velocity of shortening or velocity of contraction and after load. For example, Vmax is at 0 after load, which seems to be logic. Now I am not carrying anything in my hand, so I flex the elbow very quickly, very easily, very rapidly. On the contrary, if I carry a heavy object in my hand, velocity of shortening is going to decrease. A third statement in this question, velocity of shortening equals 0 in isometric contraction. Remember, you fail to carry the object. So here, this load equal or exceed the maximum tension achieved. Question number 26 regarding action potential of a skeletal muscle. You should know the values. Resting membrane potential of a skeletal muscle negative 90. On the contrary, in the nerve, negative 70. Firing level in a skeletal muscle, negative 40. In the nerve, negative 55. Peak of action potential in a skeletal muscle, plus 40. While in the nerve, the peak, plus 35. Amplitude of action potential of a skeletal muscle, 130 millivolt, while in amplitude in the nerve action potential 105. Remember that action potential precede, coming before muscle contraction by 2 milliseconds. Question number 27. Define simple muscle twitch and its components. Simple muscle twitch means you are going to give a single stimulus followed by latent period, then single contraction and single relaxation. Remember that latent period is 0.01 second, contraction 0.04 second, relaxation 0.05 second. Question number 28. Define latent period. Latent period means time paused between application of a stimulus to the muscle and the start of mechanical response. What are the causes? Action potential reaches the nerve. You are delaying in calcium influx. Calcium bind to vesicles. Rupture of vesicles release acetylcholine. Neuromuscular delay. Arrival of action potential across sarcolemma and mechanical response. All these causes causing delay before recording muscle contraction. Question 29. Factors affecting simple muscle twitch. You have type of muscle fibers, as I discussed, either fast glycolytic or slow oxidative. Temperature, warming the muscle, as in practical exam, you know this, warming will increase the amplitude of contraction and shorten the duration. Why the duration is going to be short? Because warming will accelerate all enzymatic and chemical reactions and decrease viscosity of the muscle. On the contrary, cooling will make the reverse. Stimuli. If you give successive stimuli. Suppose I give second stimulus after the end of the twitch. Next twitch will occur, as you know in practical PDF. If I give second stimulus during relaxation, clonus occur in complete relaxation. If I give the second stimulus during contraction, so more and more contraction will occur until tetanus. Continuous fused contraction will be the end. If I give rapid repetitive stimuli, muscle fatigue will occur, as I mentioned before. Starling law, and I mentioned Starling law in the question. Question number 30. What is the relation between electric and mechanical response? All of us know that electric response is action potential with refractory periods. Absolute refractory period is all depolarization and the upper 1/3 of repolarization. It coincides with the latent period before muscle contraction. And relative refractory period electrically, it occupies lower 2/3 of repolarization, so it coincides with the initial half of contraction. So if I told you that why muscle doesn't contract, because now it is an absolute refractory period coincide with the latent period. Or if I ask you cause of muscle contraction related to electric response, you will tell me that it coincides with relative refractory period. Question number 31. What is a staircase phenomenon or Treppe phenomenon? Treppe is a Deutsch or a German language which means stair. Gradual calcium release from sarcoplasmic reticulum will cause gradual contraction, as if you are walking upstairs from low stair to the upstair till contraction is maintained till you reach a plateau. So it is explained in a book. Suppose this pen is the start of contraction and this pen is gradual. Contraction is going to increase gradually till maintenance. No more contraction will occur because calcium will be actively uptaken into sarcoplasmic reticulum by calcium ATPase pump. Last question. Differentiate between muscle cramps and hypocalcemic tetany. Both of them are involuntary tetanic contraction. Muscle cramps is caused by electrolyte imbalance, severe cold, and excess exercise, while hypocalcemic tetany is caused by calcium deficiency, extracellular fluid. I want to imagine that voltage gated sodium channels has two gates. Outer gate, M gate, is closed during rest, while inner gate, H gate, is open during rest. This outer gate is closed by the help of extracellular fluid calcium. Now, I told you, hypocalcemia. So if calcium level is decreased, this M gate is open and H gate, which is already open, more and more sodium will influx to the nerve. This ends by more positive charge inside during rest, so you are going to be nearer to the firing level of the nerve. The voltage difference across the membrane during rest is going to decrease. So the nerve is excitable. It needs a sub-threshold, do you remember, to reach firing level. It is closer to firing level. So now if I give sub-threshold, I will reach a firing level and action potential occurs. But sodium is continuing to influx. Can I change the amplitude of action potential? No. Amplitude of action potential is constant. Once you reach the peak at plus 35, you cannot elevate the height more than that. So frequency of action potential is going to be increased. Remember that action potential is frequency modulated. So if more and more frequency of action potential reaches the nerve, so muscle contraction is progressively increased till tetany. Tetany means what? Contraction without relaxation, like this. The patient will come to your clinic with his rest like this, tetanic contraction. He cannot extend the rest. It's like this. It is tetanic contraction because of hypocalcemia. So look to the term hypocalcemic tetany. Hypocalcemia is the cause. Tetany is the result. And we're accustomed in medicine to have two parts, or the name like it is divided into two terms. The first is the cause and the second is the result. At the end of our short essay training questions, I want you to know that types of isotonic contraction, concentric, eccentric, reading, types of muscle heat, activation, resting, maintenance, activation, recovery, reading, and muscle disease are also reading. But electromyography, it is the apparatus used to record the electric activity of the muscle. Because myo means muscle, I mean by a graph, not a paper. The apparatus which records the electric activity of a muscle, suppose as in myasthenia gravis. You have autoimmune disease. Antibodies are attacking most of nicotinic receptors in motor end plate, and you still have some nicotinic receptors are normal, So this will receive acetylcholine, but it is not sufficient, so muscle contraction is decreased. You have muscle weakness. We wanted to record electric and the mechanical response of the muscle by electromyography, and we explain it before in the case of myasthenia gravis in before introduction exam last January. At the end, I hope this video will be beneficial for all English speakers. Best wishes, Dr. Mohamed Fayez.